Now I'm demonstrating how to treat the buttock and leg, calf, and if you zoom up to the map on the wall, here's the big buttock muscle. On this side you see the layers underneath, and then the hamstrings in the back of the leg here, and then also muscles in front of the leg. And because we can't take a picture of where the problem is, when people say I have hip pain or leg pain, I generally just start working in this area. Same thing with gel. Just work the whole area here and do that for about 2 minutes. And very often as the tissue softens up, you can actually feel the knots underneath the trigger points, and then you work it to soften it up and loosen it up. And the same thing happens when I go down the side here. I start with a painting motion, and when I feel a knot, then I stop and do kind of a more of a pain erasing motion. And so I can work all these muscles. I can work the front muscles. I can work the calf muscles all the way down here. And very often when I work the calf muscles, I stretch the calf while working it, push down on my hand, and have her push down or pull up, work the front part of the muscles. But essentially you work all the soft tissue, much the same as the shoulders or the back, and let the device show you by either redness or tenderness that you're in the right spot. And if you just continue to work these areas, for instance, if you have problems with plantar fasciitis, which is down here, I always work these calf muscles first and then go underneath the foot here. If it's a sprained ankle, principle is the same. I work the muscles on the side, work the muscles, usually the sprain is on this side here, work this as well. And with the knee, I work the front of the muscles here, the knee muscles themselves. So if you look on the wall here, you see all the big back muscles of the thigh and how they swing around and attach to the kneecap, and then attach here at the knee, at the bone, the lower leg bone, the tibia. And so when people have pain in this area, I always make sure I treat these muscles as well, to make sure that if there are any bands or knots here, that we take care of that and then help them stretch it out. If you're working on the calf muscles here, as you can see, you work this and then you work on the bottom of the foot here because there's muscles that go all the way and tendons that go all the way down here to the toes. So essentially, the concept of this is it works on all soft tissue because it works at the cellular level. And if you think of the body as having a skeleton, and if you zoom at the skeletal map here, there's a lot of bones. Okay? We have about 200 bones in our body. And as you can see, these white strands here are ligaments that tie the bones together. But even with that, the bones can't move on their own. They need the muscular system, which is this part, the soft tissue, that are the ropes and the pulleys to make that joint move. But you also have to have a healthy nervous system. So the nervous system comes from the head here, and along the spine, there's all these nerves that actually come out to instruct these muscles to contract or relax. And then there's also part of the nervous system that gets feedback. And for instance, if I use the electrical current on my body, then electricity is the sensory nerve that feeds back to my brain to let me know that I'm doing something here. Okay? And so the principle is very simple. Work the soft tissue. In most cases, the body will tell you that you're in the right area. Work it till it loosens up, till the person can move and doesn't have the pain or has better range of motion. And after the initial pain is less or gone, very often they say, oh, I have another pain somewhere else. Well, that pain was there, but the brain wasn't paying attention to it because it had to pay attention to the worst area first. But as soon as that got better, help the other areas. What you do is you just go to the other areas. And depending on the case, if people have had pain for years and years and years, they may have a lot of spots in the body. But it's okay. You can work it and treat it. And basically, what I tell my patients is that this device, the Dr. Kaki Laser Touch 1, gives you now control of your pain, and as you have control of your pain, you get a quality of your life back instead of pain controlling you. So use it, enjoy good health. Thank you.